All right, today we have Callie on here. And so Callie is going to take you through a little bit of what her struggles were, where she was, how she found out about the 14-day reset, and basically just what has changed, how she's changed things, the learning curve of things that she just wasn't told a lot by a lot of other medical professionals, and her journey through all the things that have been going on and where she's at now. So I'll let Callie go ahead and tell you a little bit about her.
And so my name is Callie, like Dr. Homer said. When I started working with Dr. Homer, I was 22 years old and turned 23 in the process. So still like a young individual, like experiencing kind of like gut health issues. I would have a lot of like stomach pain and cramps and nausea and loss of appetite, and I would just lose like a ton of weight, and I had no idea why. I went to my primary care physician. She did blood work, she did urine analysis, she did an x-ray, and all of that came back normal. And so she told me to get scheduled for a CT. So I got scheduled for the CT and did that with contrast and everything. And when I got the results back, I basically got a call from a nurse saying, "Yep, your CT came back normal. There's no reason you should be having these pain issues." Um, and that was kind of it. So then I went to my gynecologist to see what was going on, and they couldn't find anything wrong. They said everything was normal. They tested for everything basically, and nothing was coming back. So my sister actually tagged me in one of Dr. Homer's Instagram posts, talking about gut health and inflammation and all of that. And that made me take Dr. Homer's inflammation quiz, and we found out that even starting way back to the time when I was 14 years old and was dealing with kidney stones, that all of this was kind of playing a role in each other. Like the reason I was having kidney stones, the reason I'm having gut health issues, all of this stuff. Um, and even before talking with Dr. Homer, I had an endoscopy done. They did a scope down the throat to look at my stomach, my esophagus, and they basically said, like your stomach and your throat is super inflamed, super irritated. We're not sure why. Avoid fried foods, acidic foods like lemons, oranges, fatty foods, just like avoid it, take it out of your diet. We'll put you on this pill, and I want you on this pill for at least a year, and we'll check back in and just cover up that inflammation, have it coated, and then we'll, check back in. When I took the inflammation quiz with Dr. Homer, um, I found out that there is a way to like live your life that's not being married to medication, that's just covering up inflammation and all of these like symptoms that you're having that no other doctor can explain. Um, and she wanted to look more at like the cause, like why am I having so much inflammation? Why is it just being covered up? Like let's get to the bottom of this so we can get rid of the inflammation instead of just like coating it, like the other doctors were kind of explaining to me. So basically, what we did is we did a DNA test, sent that in, and found out that some of my foods that I had to avoid that were causing a lot of issues were foods that I would eat every single day. Foods like gluten, black pepper, onion, eat them on almost every single meal, have them with almost every single meal. And we found out, wow, okay, these are some like big things that my body has been trying to fight, and we would have never known about it had I not started this program, had I not done like the DNA sample and stuff like that. So we got on some supplements, and I've been taking those for, oh gosh, like a couple months now. I am better able to um, eat like foods that I was told that I could never eat before. Like I can now have like lemons and have a lemon in my water like I always used to enjoy. I can have, like oranges and stuff. Oranges are one of my favorite fruits. I can have that. I usually don't eat a lot of fried foods, but if I'm just like kind of like feeling it, obviously I don't do gluten, but like one of the things I found was like gluten-free chicken nuggets. And so I had those actually for lunch yesterday. So just being able to recognize like my body's signs and symptoms and what my body's telling me, what it wants to eat, what it doesn't want to eat. And I'm better able to get the signs from my body about, okay, I'm going to look at this, amazing slice of pizza but then like my stomach starts to kind of turn a little bit, and I actually learned from Dr. Homer that that's just your body saying like, nope, we don't want that, like turn away, that's not something that we want right now. So kind of just like a mechanism of protection, in a way. Like obviously this isn't a forever thing, but just in this time now to like get rid of the inflammation and calm my body down and everything like that. I went from 128 pounds in February to 104 pounds in April. So obviously that was a huge thing. Like my family was super concerned. I was super concerned. Why am I losing so much weight? Why do I not have an appetite? um, all of these different things that just weren't lining up until I was able to take this inflammation quiz and kind of get my body turned around, and just get back on track to what like my body wants and my body needs in order to be like healthy again.
Thanks for all that. That definitely encompasses a lot of what has been going on. So one of the things that we found through doing the testing, with the gut tests and the foods, is that we found that Callie wasn't breaking down foods how she needed to. So that was another thing. Not only was she eating foods that were pro-inflammatory for her, which is very individualized. I think it's one of those things. Personally, coming off like Whole30, I would eat these like cleanest, least inflammatory foods, and I still was having GI problems and other problems in my body based on inflammation. And it was really frustrating because I'm like, I'm eating as healthy as I can, and something is still not right. And it wasn't until I started doing some of these tests on myself personally that it bridges a gap. Like I had like bell peppers and tomatoes, which I was eating a ton of because those are paleo compliant, those are Whole30 compliant. They're not supposed to be inflammatory for people. And that was the bridge for me, is that I started to realize that even some healthy foods aren't healthy for me. And that's definitely what we found with Callie too. Like most people should be able to handle black pepper, but like, and it's everywhere. And so it's one of those things, she was probably putting black pepper on her food unintentionally, not realizing that, this was creating, a worse outcome for her. And then also along with that, she was eating foods that, had been told to her, like, these are easier to break down, they're less inflammatory, they're not acidic. But the problem is that we're actually, lacking a lot of the enzymes and a lot of the acid that we needed in her stomach to actually break any food down. And so the digestion process was all wonky, and she was getting a lot of pain with it because her body's like, hey, you're feeding me these foods and I can't break them down. Like, I don't know what to do with it. And so then, that led to some malnutrition for her, and obviously some unintentional weight loss, which is very scary when people just keep telling you, oh, yeah, you're inflamed. Like, just keep taking these proton pump inhibitors and like, we'll see what happens in a year. Like, maybe you'll be here, maybe you won't. I mean, like, that's sadly the reality of it. And I don't mean to be dramatic, but I'm sure that you're probably feeling that for a few at some point too, Callie, where you're like, I don't know what to do. I can't eat. Like, it doesn't feel good. It hurts.
Hmm. Yeah, absolutely. And I think like something else too, like not only did it like hurt and everything like that, and like people were just covering it up, just kind of not like you said, it was unintentional weight loss. Like for me and my family, I am one of 5 sisters, so like I have a big family, everything like that. And I eat like usually like super healthy. Like I graduated with my bachelor's in kinesiology, so like I know about the medical field, stuff like that, eating healthy, working out, and I would do all of those things. Whereas I have a sister who drinks Dr. Pepper for breakfast, and like that's what it is. So like for me, just thinking, okay, I'm eating healthy, I'm working out, like why do I still feel like crap when my sister's over here eating and drinking whatever the heck she wants and she's fine? So that was
Right.
something that I was like, what is going on? And something that we were able to kind of dive into and unleash with this program is just figuring out like the core of what's going on and what's happening, and then how to kind of reverse it back to being healthy again.
Yeah, and that actually brings up a good point. And I know I've talked to you about this before and other people, but that generational gap between, us, like from like 40 and under to like 40 plus, is that they just lived a much different lifestyle and haven't been subjected to a lot of the same like food additives and processed foods and antibiotic use and medications. And like that's the thing, is that you've been on medications for about half of your life, due to problems that you had underlying for a long time. And that can even start wearing away your gut health. We're exposed to a lot more chemicals in our environment through stuff we put on our skin and chemicals in the air and pollution, all that stuff. And I think that that's something that's really hard for our parents to understand. I'm speaking personally from this, because they really do. I have great parents. They want them, and I know you do too. They want the best for you, but they just cannot understand how you don't feel good or what's going on and why there's no answers. And it's almost like at some point you probably start to kind of feel a little crazy, like doctors can't figure out what's wrong with me. Like maybe it is in my head. And like then you talk about even like some of the signals you get from your body when it's like, like things that have made your body feel sick in the past will start to give you some stomach aches, even just like looking or recognizing that food. And like these are all things that aren't aberrant. Like they're your body's doing this for a reason. It's trying to protect you from danger. But it's really hard to understand how symptoms occur and why they occur, because our medical system is just like you said, cover up everything. Like let's, if you have that symptom, let's just get rid of that symptom. Like no big deal. You don't need that symptom, but that symptom is your body trying to communicate things to you.
Right. And for me, like for the longest time, I remember just like finding protein shakes or making protein shakes that I could like trick my body into where I wasn't like physically eating, but I was still drinking and getting some sort of protein. It may have been, like 20, 25 grams, which obviously contributed to my weight loss, not getting that source of nutrition that like my body needed. And my family would still try, oh, I'll make you a sandwich, like eat this, or I'll make you toast, eat this. And my body was just like, nope, we don't want it. Like I would get so nauseous. And that's something that like I would explain to them, but it's different when you're like in that position versus like when you're on the outside looking in. And obviously, like you said, like your parents, like our parents just want what's best for us and they're trying to help. But until they can like feel that pain or like what your body, like what signals your body is sending, all of that, it's not like super helpful. Like I would try and eat stuff and I would take maybe 2 bites and just be like, I cannot eat that. Like my stomach's like, nope, we don't want that. And honestly, most of the time it probably was gluten. It probably was like toast, like something like you eat when you're sick and
Right.
like you're trying to get your body back on track or whatever. But just not knowing what the actual problem was also kind of hindering. And then like you said, your mind starts going crazy. Like for me personally, I was dealing with a lot of like anxiety and depression on top of it because my mind was like, okay, all of these doctors are telling you everything's normal, you should be fine, why are you in pain? And yet I know that I'm in pain, yet I'm not getting any answers. So I'm like, what's wrong with me? Like, do I have cancer or do I have some disease that nobody has even come up with yet? Or, just all these different things just rummaging through my mind because all of these tests are coming back normal, yet I know that I don't feel normal. So I think this has been something that's just been super helpful, is just getting to the root of the issue and then dealing with it instead of just covering it up like most doctors are kind of wanting to do.
Going through the 14-day reset, I guess what was like some of the aha moments that you had, even just like as we connected, what really sold you on the program and like, or what kind of like connected with you that's like, okay, like she is different and this is definitely going to help me.
I think for me, was like I said before, like just getting to the root of the issue. Like you personally, like as a gut health doctor, you have that background in the musculoskeletal, and like you told me, like you've seen patients who come in for therapy or whatever, and they do the exercises they're supposed to do, they do like the home exercise program they're supposed to do, yet they still come back. And how you were kind of like, why, like what's going on, inflammation. And I feel like that's something that I have never like heard from a doctor before. Like usually, doctors are like, okay, like that's weird, like just keep doing your stretch. It like it'll go away, something like instead of actually like diving down into why. And that's something that was super helpful with me after getting brushed off by multiple doctors. And even having that one nurse tell me like there's no reason you should be in pain, yet I was in pain. Like just not getting, I guess, that rapport, that patient rapport that a lot of patients want to get and want to receive. Um, and honestly, when my sister tagged you or tagged me in your post, I was like, okay, like we'll see how this goes. I'll take the inflammation quiz. I've done all of these other things. Like, what can hurt? One more doctor, whatever. And then actually, like, getting to meet with you and you breaking down, okay, you're 23 years old, yet you've had kidney stones ever since you were 14. Um, you've been taking, like different medications your whole life, whether it be for kidney stones or sickness or whatever, and all of that adding up to your inflammation and your gut and all of that. And I think just for me personally, I felt for the first time in a long time that like you were a doctor who wanted to help me and who knew like you couldn't see my pain or feel my pain, but you knew that I was having it. And just having like that compassion towards your patient and just really, I guess, caring instead of being like kind of dismissive about it and being like, oh, I don't know what's wrong. So, sorry. That was something that really, really helped me. And then just, being able to, like meet with you one on one, like weekly, and do um, the food log that we would do, and just keeping track of that and being like, oh, okay, I ate this. And maybe that wasn't the best choice. And maybe that's why I had more stomach issues that day, like just fully being able to break it down from every single meal to the water intake to, just all of it. Like you actually care enough to put all of this together and to actually help people instead of just trying to cover it up.
And I think that you really resonate too with an analytical mind. Like I can see that over the last few months, understanding who you are, I think that
Mhm.
that's one of those things too, where I'm a very analytical person. I'm very curious about, like you said, like, okay, like I'm getting people better range of motion wise personally in the office, but they're still feeling a lot of pain. They're feeling a lot of symptoms, and they're just generally not like progressing how I expect, like what could be going on. And like that's kind of like my nature, is just to be very curious about things, and instead of dismissing things or being like, well, this is just like you, um, let's figure out, let's see if there is something we can do. Because sometimes it, at the devil's advocate, sometimes it does have to come down to like this person just has something that I cannot help with. But at least you can get them referred out to someone that can help. And furthermore, I understand the pain of like feeling dismissed, because when I was experiencing eczema, which is very superficial compared to the struggles that you've been through, but I was also very upset too the way I was dismissed. And like it was like, oh, here's three things that can be causing it. Take this antifungal steroid and put that on your body. And I'm like, this doesn't make sense. Like,
Yeah.
why would I don't need a steroid. I don't have a deficiency in steroid in my body. There's a reason why this inflammation is trying to surface and tell me something. And yet at that point, I didn't know either. I was, pretty focused on the musculoskeletal component of my education in practice. But like this was like my big flipper switch. And they kind of say like your mess becomes your message. And that was my mess, where I was frustrated and I was sick of not being heard. And I didn't want to be put on pills or potions the rest of my life, that my body was trying to tell me something. So I think that's probably where it comes in, is that, I'm obviously a very compassionate and caring person
Mhm.
anyway, but the frustration that a lot of people share with the medical system, I was there too.
Yeah.
So tell me a little bit about, I mean, we talked a lot about the gut health component. What are the other things in the 42-day reset that really helped, just kind of like your overall health? Or what, tell me a little bit about like, even like some of the hydration aspects, getting you moved, doing some yoga and stuff like that, that a lot of other doctors aren't, either they're telling you it, but they're not holding you accountable. They're not helping you check in. They're not saying like you said, if something didn't go well in a week, we were able to address it at the next check-in and say, okay, well, this doesn't work for you, or this isn't going well, let's adjust this little piece and see how that does. And then we'll know what works best for you.
Right, for sure. Um, I think first and foremost, like I have never had a doctor who has been here like through the whole like step by step process, like on a weekly basis where you check in with them. Like usually at doctor's visits, you go in for your issue and then they're like, okay, yeah, let's do this. And then we'll see you in 3 weeks. Like it's not on a weekly basis where you actually get to talk, like whether it's on a Zoom call or a phone call or whatever with your doctor. So that's something that was super, super helpful for me. The hydration, I mean, everyone's going to tell you, oh, you need to stay hydrated, drink water. Okay, duh, thank you. Um, but I feel like for me, just having you coach me, like, okay, I want you to get to this point where you drink X ounces of water a day, but we're not going to just introduce it right away. Like, we're going to build up. So, like, I was not drinking a ton of water, which is rare for me because usually I do. Usually I stay super hydrated. I've worked at different hospitals before, so staying hydrated is super important with being on your feet all day. Um, and So usually I was super hydrated, but just with everything going on, like my stomach was not okay. So we started off, at slow doses of water, like every day, like, okay, drink 20 ounces of water a day, drink 10 ounces in the morning, like right when you wake up. And then, that gets rid of like the inflammation in your body and all of that stuff. That's something that I learned that's been super helpful. And I still do it to this day. And I probably won't stop doing it, is drinking water right when you wake up.
Mhm.
And then also, I guess just the movement aspect. Like when you're in that painful, gross kind of state, you're like, the last thing I want to do is get out of bed and move and, have whatever's in there, like all that acid, like move around. But with hindsight being 2020, when you actually do it, it's actually so helpful. Like I would walk outside my parents' house and they live on 5 acres of land. So I'd walk around the property like 4 or 5 times and just get like a short walk in, whether I listen to music or like sometimes my sister would go with me and we'd just talk. Um, and just really kind of like getting that movement, like stuff that exercise that's not super strenuous, but then it's still something where you're not like sitting on the couch all day, like hating your life because your stomach hurts and your mind's going crazy because why does my stomach hurt? Um, so I think that's super helpful and it's still been helpful. Even today, like my fiance and I go on walks with his dog and, just take him around the property. And I've been able to kind of like teach him more of the stuff that I've learned, just with personal things that he's been going through with his health as well, with the diet and the movement and stuff. And then I think with the whole like mental health aspect that comes into play, your mind's going crazy, something that for me during my experience with all of this is I was not sleeping very well. And I would tell Dr. Homer, I'm like, listen, like it's so hard for me to get to sleep. And then once I'm asleep, I'm waking up like X amount of times during the middle of the night. Like I don't know what to do. And there came a time where like I would just like wake up in the middle of the night just so hungry. And I was like, why am I hungry? Like I'm never hungry. So this is so weird, but I'm used to like, okay, I wake up in the middle of the night, I'm hungry, but like I don't need those calories because I'm not going to burn it off if I'm sleeping. Well, it got to the point where Dr. Homer said, listen, if you wake up, you're hungry, eat. Like just eat whatever. Like if your body's wanting you to eat, then listen to your body. And so once I started doing that, she said like a nice mix of like carbs and fats for me, just to help, get some of that nutrition back in my body for my body to hold on to. And just with adding that in, I would start to eat that like probably half an hour before I would go to bed, just so I didn't wake up in the middle of the night like super starving. Um, and I was better able to sleep. Like it was like night and day difference. I was like, wow, like who knew that I just needed to eat some food, even though my, whole body during the whole day was like, nope, we don't want food, but now we do. And so just going back and forth, it was super crazy. But working on the movement, the sleep, the hydration, another thing was like breathing. So like with me, I was losing so much weight that like, obviously I don't want to work out and get that like strenuous exercise in because I also learned strenuous exercise could also be a result of all of this inflammation and this gut health stuff going on in my body. Um, so Dr. Homer gave me some exercises to do. So going through those yoga exercises and getting still some form of exercise in that's not overly strenuous, but not only does it like calm your body and get like movement in, it also like helps calm your mind. And so that was something that was super helpful, in the breathing aspect, like just being like, okay, breathe in and hold and then breathe out. And it sounds like super silly, like, okay, I know how to breathe, but like when you're in that stress state, sometimes you just like forget, like, okay, take a deep breath, everything's fine, and just breathe. So for me, that's kind of how my experience went with, the movement, the hydration, the nutrition, with avoiding the gluten, the onion, the black pepper, um, and then the breathing and the sleep. And just checking in like every week with this program, you get to track like your wins, and where you got like the most wins. And then like, oh, you didn't do so well with drinking your water. Why do you think that is? And one of the things for me was, okay, I was drinking water, but I would grab a water bottle here and fill up a cup of water here. And then I'd go to work and fill up water. And I'm like, wait, how much did I drink? Like, did I drink 30 ounces or something? And so it was just like having Dr. Homer be like, "Hey, this is a water bottle that I use. It's on Amazon. Here's the link. Like, it's a nice water bottle. It's cheap. Here you go." And so now that I have that water bottle, um, I think just it was so much easier to keep track of my water intake. Like, oh, okay, this is the fourth time that I'm filling it up. Okay, this is a 20-ounce water bottle. Great, perfect. So I think just the little tips and tricks that Dr. Homer gives you during this whole program that I've never had any other doctor go out of their way to do this. Um, is super helpful, and just knowing that your needs aren't being dismissed, and she's more than willing to, kind of help you out, like depending on like which program you choose. There's different like tips and tricks that you get with each of them. So like meeting with her like every week, and then like being able to like message her and being like, hey, like this, isn't really working out. Is there something I can substitute it with? Just whatever. Just always having that ability to reach out to her, which I think is also rare with a doctor. But is super helpful with this program, is you can reach out to her any time of day. And I still do like all the time. Like I just message being like, hey, could I donate blood? She's like, probably not yet, but like encourage your friends. So, just having that like peace of mind, knowing that she's actually here to help and she cares, and she's looking out for the best for you, and it's a very individualized program. So what works for me may not work for you, and vice versa. But she does have that mindset, like, okay, like this isn't working. Okay, let's try this. So that's been super helpful, is like it's trial and error, but she's not going to be like, oh, that didn't work. Okay, like I don't know what to do. Like she has always been helpful in finding like different ways to like help me specifically towards my healing process.
Yeah. And that's like even like, so I love you talking about like some of the awareness that you picked up. And I think that's the biggest thing, is that, there's a lot of things that we know we need to do, drink water, we need to move more and all these things. But when our tasks are so ambiguous, it's really hard to know what to do, when to do it, and in what amount. And so then it's like that all or nothing mentality. And guess what? Nothing is probably going to happen a hell of a lot more than something or all, if you don't really have a plan of attack. So that's one of the things that I think you did a really good job explaining, is that like this is a fluid plan. Like not everything that I'm going to say is going to be set in stone, and it's going to be the right exact thing for you at that moment. And things are going to change. I know that you've been going through some life stressors, and that's one of the really cool things I'm really proud of you for, is sticking with, is knowing that you have all these tools in your toolbox, and going through some really rough times in your life. But you were able to lean on these tools, and you're like, okay, I know what to do. I just have to create a plan of action for it. And it's probably going to look a little different than it will be, in normal life, but you were still able to lean in and utilize those tools. And that's, keep your head above water, which is so important, because life's not always going to be a walk in the park. And so when you already know you kind of have these defaults, or these, ability to reset some things, that's super powerful, and, helps you stay on track a lot. So that's really cool.
For sure. For sure.
And so where do you think you'd probably be now if we wouldn't have done the 42-day reset?
Honestly, I don't even want to think about where I would be now. Like I'd probably still be taking the pantoprazole medication and avoiding all of these foods, and still feeling awful because I'm avoiding foods that they told me to avoid that was causing the inflammation. Yet I'd still be eating gluten. I'd still be eating black pepper, onions, like in my daily food intake. And I'd still be like, okay, like I'm taking this medication. They said it helped. Maybe, it just needs more time to kick in or something. Like, I don't know, maybe my body's different. Like, just all of these questions that would kind of like rummage through my mind. I honestly have no idea where I would be, and I don't even want to think where I would be without like this program. This program has been like so helpful, but I still think with everything in me that had I not started this program, I would still be in a ton of stomach pain, cramping, like bloating, like all of this stuff, and not getting to the root of the problem. Just being like, okay, like I'm not eating acidic foods, I'm not eating fried foods. So, like, why do I still feel like this? Like, my doctor said, don't eat this stuff, and I'm not, and I'm taking the medication. Like, I'm doing everything they're telling me to do. Yet here I am still feeling like crap. So, what's going on? And after going through all of those like tests and everything that I said at the beginning of this, getting no answers, everything's normal. I think it would be like a huge downhill spiral. And I, d- I feel like there's a point where it just eats at you. Like for me, like my mental health, and there's been some things that I've told Dr. Homer, like one day I got super lightheaded and I was at my sister's house and I just got thrown into a panic attack. And I was like, I'm going to die. This is it. I'm going to die. I'm lightheaded. I see stars. I've been drinking my water, all of this stuff. Something that I didn't realize was okay, like you've lost so much weight for one. For two, like you're getting ready to start like your menstrual cycle. And for three, you have not like you're losing this iron, but you're not like replenishing. So that was something that Dr. Homer and I talked about was like, okay, like this is what the cause is as to why you felt lightheaded. So this is how we can fix it instead of like, oh, okay, you feel lightheaded. Just sit down, sit down. It'll go away, like it's just silly things that like you don't even think about until you're in like this type of program where you have a doctor who like actually cares and wants to help. And if one thing doesn't work, then she's more than willing and able to be like, okay, that didn't work. Okay, that's cool. How about let's try this? For example, some of the supplements I took, um, we started off, I think the second supplement or third supplement was my probiotic. And I was telling Dr. Homer, I was like, listen, like my stomach is not okay. Like I don't know what's going on. I was on like mental health medications as well for like anxiety. And I was like, I don't know if it's that. And she's like, well, let's just try like cutting out the probiotic for now. Maybe it was too soon to start it. Maybe your stomach's still not at that point where it wants that probiotic and that it's willing to like take that probiotic. And so I was like, okay, so we stopped that and then we checked in that next week and I was like, I think that was it. Like I feel great now. Like, maybe it was just too early. So just those little things that no other doctor would really like care to look for. Like maybe they'd be like, "Oh, your stomach hurts. Okay, well like I don't know, like drink more water, take some Tums, something like that." That was also something I was doing was taking Tums and oh my gosh, I'm so glad I don't have to take those anymore because it's just been so helpful. And so just like really realizing and recognizing that it's okay if one thing doesn't work because it is a trial and error process. So if one thing doesn't work, like message Dr. Homer and be like, hey, like I really this is what I'm feeling, like this is what's been different from the last time we talked, like what are your, ideas or whatever. And so I just think that that's just super helpful just to kind of have you in our back pocket, um, just to, talk to you kind of about what we're feeling and why and what's changed ever since the last time we talked. And I know something for me, my fiance was actually, he just got out of the hospital from being hospitalized and it was a pretty like bad situation. And so I did not want to eat anything. Like I was so nauseous. I was like, I can't, I was like, what do I do? Like I have to eat. I can't keep losing weight. And so I messaged Dr. Homer and I said, hey, this is my situation. I'm not hungry at all. Like I can't lose any more weight though. Like I'm almost to the point where I'm underweight and it could be dangerous. And she's like, okay, here's what you do. You drink smoothies and you drink protein shakes, and that's going to be your protein. Like right now, your body is in so much like shock and adrenaline mode that it doesn't want food, but like obviously you need that nutrition. And so, like I said, just being able to have her in your back pocket where like if you're like, oh shoot, like what do I do? What do I do? There's really no other doctor out there who's willing to be like, yeah, text me or Instagram message me or kind of whatever. And she's just always there to help you out. So I think that's been like crazy, crazy helpful for me during this whole experience.
I love it. Yeah. And that's the thing is that the open communication lines, a lot of things can be, we just have to adjust a few things and we can figure out how to get through that. And so I appreciate all your kind words about that. But that's something that's integral, I think, to any kind of relationship with a doctor. And unfortunately, in the medical system, the normal medical system, doctors just don't have the time and attention to spend with patients one-on-one like that. And so you can see the difference in health outcomes because of that. And,
Right.
I honestly don't know how to fix that, but at least if I can fix one person at a time, by, fixing it that way. That's the best we can do. That's great. And hopefully our medical system starts to push that way. I don't think I have any other questions for you. So if you have any other comments, Callie, otherwise we can wrap it up.
I mean, for me, like, if you're one of these people, those people who's watching this and is like, maybe this is for me, maybe it's not, like, and you've been going through what you've been going through, I mean, take it from like I was one of those people that was skeptical. I'm like, I've been to all these doctors, all these healthcare professionals, done these tests, everything's normal. So it's another doctor, everything's going to be fine, like it's normal, just move on. But just kind of like take that leap of faith in a way and be like, okay, like the worst that can come out of it is, like I'm fine and everything's fine. But I think with this program specifically, you're going to realize that your body is actually sending you these signals and you're kind of confused right now because you're not used to it. And just knowing from like someone who's gone through the program and who is like still like in contact with Dr. Homer, and from where I was months ago to where I am now is like a whole night and day difference. And I just think it's so important, and gut health can kind of be dismissed because when you think of like injuries or physical health issues, like you really don't think of gut health. And so a lot of people are like, oh, you're not hungry. Okay, whatever. Oh, your stomach hurts. Okay, well, take Tums, or, like take whatever medication that's going to help you cover it up instead of get to the root issue. So I think if this is like speaking to you today, like just reach out to Dr. Homer or take her inflammation quiz or whatever, and just really like put yourself out there to that healing that your body wants and your mind wants and all of this, and just give yourself that peace of mind knowing that she's going to do everything in her power to like help you just like she helped me. And I just really hope that you guys take this seriously, because what you put into it is what you're going to get out of it as well, kind of like with any other program or whatever. So just really go after it, listen to what she says. If you have questions, like don't feel like timid to like ask her or anything, because that was something that helped me also, was like, okay, this might be a stupid question, but I don't care because I don't know the answer, so I'm going to ask. So I honestly believe that if you've been experiencing like some of these symptoms, all of these symptoms, more symptoms, just reach out, because this program is really, really, really going to help you.
Perfect. I appreciate that so much. And
Yeah.
yeah, it's one of those things too where like there's never a stupid question. Like
Yeah.
I'm not a hairstylist. My sister is, or like if I was like, can you do this hair thing? She wouldn't be like, no, you're an idiot. That your hair could never do that. I mean, if she did, I'd slap her. But you know what I mean? Like we don't know things outside of what we don't know. So like there's reasons specialists are there for a reason. I'm not good at photography. I'm not good at art. I'm, not a lot of things. But it's one of those things where you have to realize that there's really no dumb questions. And the sad thing is too, is that you probably already asked this question to another healthcare provider and they didn't have the same answer for you. So I think it's kind of scary for people because they're like, well, I've already been told this answer, but like it doesn't set well with me. So it just like, that's just like, I don't know, maybe it's me. But there's a lot of different perspectives. And the thing with medicine is it is a lot of trial and error. As much as we want to believe that everything is straightforward, there is a lot of trial and error going on with medicine, and nothing's perfect. And we're all kind of like an individual case study. Like we can, like as a population, there's big trends in like the way people, have symptoms or whatever. But this individualized medicine is really what's going to hopefully be the future of medicine. And that will actually get us to a good spot. As we know, our medical system is not executing appropriately for the amount of money we put into it. So there's a big piece of the medical system that's missing. And I think that care like this is what it is.
Right. Well, and I think too that like with gut health, like it's something that's not, researched as much as like musculoskeletal or mental health or kind of everything. Like it's like up and coming. And so I think that that's what's hard too, is like people are like, oh, you have inflammation. Okay, here's a medication that helps with inflammation. Like that coats it. I've been through a ton of those medications, a ton of the over the counter just like drinks. Like one of them was like Gaviscon that I tried, that like you drink it, it coats your stomach. Disgusting.
Yeah.
And so I think just having like you be in that position to not only want to learn about it, but want to help others with what you know and what you learn is also super helpful. And with you being someone who's like gone through it yourself, is super helpful because then you know what we're feeling. And so it just builds that rapport even more.
Yep. Perfect. Well, I appreciate all your insights and sharing
Yeah.
with others.